Good morning. Today's video covers the most critical medical news for March 21, 2026. Intro and top medical headline: the exoskeleton breakthrough. Lead, University of Utah researchers have just unveiled a lightweight, portable hip exoskeleton designed specifically for stroke survivors with hemiparesis. The impact: about 80% of stroke survivors experience impaired motor control on one side, which often doubles the energy they expend just to walk. This device aims to restore natural gait and reduce the massive energy drain that currently leads to fatigue and falls. Weight loss pills, new FDA approvals, and the right to health. Medical news today. The obesity revolution, oral and high-dose meds. Wegovy HD approval. The FDA has just approved Wegovy HD, 7.2 milligrams, a higher dose version of the popular semaglutide injection for long-term weight maintenance. The rise of orals. All eyes are on orforglipron, Eli Lilly's experimental daily weight loss pill. Unlike current options, it doesn't require injections or strict fasting. Generic price drop. Experts predict that as the first generic versions of semaglutide enter the market this month, costs for some starter doses could drop by nearly 50% to 60%, significantly increasing accessibility. Breakthrough FDA decisions and clinical trials. Psoriasis treatment. The FDA recently approved icotrokinra, the first ever targeted oral peptide for moderate to severe plaque psoriasis, moving treatment from needles to a once-daily pill. Rare disease wins. Yuvalil has received accelerated approval for children with achondroplasia, the most common form of dwarfism, while Lorges was approved for arginase 1 deficiency. Alzheimer's reality check. Results from the EVOKE trial showed that oral semaglutide failed to slow Alzheimer's progression, a sobering reminder that GLP-1 drugs aren't a universal cure-all for neurodegeneration. Digital health and AI at the bedside. AI diagnostics. Microsoft's Copilot Health and other AI tools are now matching radiologists in breast cancer screenings and even detecting pancreatic tumors before symptoms appear. Smart devices. New at-home tech like the Eli Health thermometer, saliva-based cortisol tracking, and EEG headphones that monitor brain activity during sleep are hitting the market. Digitization of doctors. Platforms like HealthPlix are using GenAI voice-to-text to help doctors generate prescriptions instantly, aiming to reduce the administrative burnout that plagues modern medicine. Global health and policy shifts. India's self-reliance. At the Hospital Procurement Leaders Summit, officials declared India is transitioning from a consumer to a creator of high-end medical devices to reduce reliance on expensive imports. Legal landmark. The Delhi High Court ruled that denying timely treatment at government hospitals is a violation of the right to life, Article 21, ordering reimbursements for a minor denied care due to lack of supplies. Child mortality progress. A new UN report shows global under-5 deaths have halved since 2000. But progress has slowed by 60% since 2015, with 4.9 million children still dying annually from preventable causes. Lifestyle and preventive medicine. Warning: PM Modi took to Instagram to warn about the health risks of excess sugar consumption. Stress causes significant glucose spikes in people with insulin resistance, making stress management a critical pillar of diabetes prevention. Smartphone detox. Researchers found that restricting mobile internet for just 2 weeks can restore sustained attention to levels seen in people 10 years younger. The big picture: 2026 is the year of oral alternatives, from weight loss to autoimmune care, and the rapid scaling of AI in clinics. Nephrology breakthroughs, find CKD and new biomarkers. Finerenone news. The Phase 3 FINE CKD trial results were recently announced, showing that Finerenone, Kerendia, significantly slows kidney function decline in adults with non-diabetic chronic kidney disease, CKD. Previously used for diabetic CKD, this study confirms it meaningfully improves the eGFR slope, a key predictor of kidney failure risk, over a 32-month period for a much broader patient population. A new kidney compass. Researchers from the International SONAR trial have identified urinary clusterin as a superior biomarker for monitoring CKD progression. Unlike traditional serum creatinine or eGFR, which can be lagging indicators, urinary clusterin provides a more sensitive, real-time look at how kidneys are responding to treatments like endothelin receptor antagonists. Tech Spotlight. The suitcase dialysis machine, the Dutch NeoKidney. Clinical trials are currently underway for a revolutionary portable hemodialysis machine weighing less than 29 pounds. Why it matters. Designed to fit in an airplane's overhead bin, it's intended for short, 2-hour sessions 4 to 7 times a week, aiming to give dialysis patients their mobility and quality of life back by late 2026 or early 2027. Global Health and Conferences. World Kidney Day theme. The official message for 2026 is Kidney Health for All, caring for people, protecting the planet. There is a major push this year to link environmental policies like tackling air pollution and global warming directly to kidney disease prevention. Events today. The International Conference on Nephrology and Renal Nutrition is kicking off today in Mumbai, India, March 21, 2026, focusing on bridging the gap between theoretical research and practical bedside care. Indigenous MedTech. India's Union Minister Anupriya Patel emphasized today the urgent need for a self-reliant medical devices sector to reduce high-cost import dependence. Quick hits and health warnings. Cardiology warning. A new study published today links menopause before age 40 to a significantly higher lifetime risk of heart disease. Cancer and probiotics. Scientists have successfully engineered probiotic bacteria to act as tumor-hunting drug factories in mice, delivering cancer-fighting drugs directly into tumors. Environmental risk. New research links early exposure to PFAS, forever chemicals, to lower bone density in teenage girls. Colorectal cancer, CDH1. A proof-of-concept study suggested that a marker of colorectal cancer, CDH1, can be detected in wastewater and could serve as an early warning system of areas to target screening. Journal of Epidemiology and Community Health. MedPage today. Hair wash. Getting your hair washed at the salon should be a relaxing experience, but in rare cases a trip to the hairdresser can result in an emergency neurology consult. Dizziness, weakness, numbness, or a sudden headache following a hair wash could be a sign of beauty parlor stroke syndrome, a vertebral artery stroke resulting from compression of the vessels on the back of the head. If the hair wash was a prolonged experience and the neck was hyperextended to reach the sink, the vertebral arteries, most commonly, could get pushed or compressed and decrease blood flow to the brainstem area, explained Anna Huller, MD, Director of Neurology for Northwell Health's Westchester region. MedPage today. The use of metformin was linked with a reduced risk of esophageal cancer in a Nordic case control study. JAMA Network Open, MedPage today. Social media is here to stay, whether a boon or a curse? That's the million-dollar question, isn't it? Honestly, it's a bit of both, depending on how you use it. On one hand, social media connects people globally, provides instant access to info, and is a massive platform for creativity and free speech. On the other hand, it can be a breeding ground for negativity, comparison, and mental health issues if you're not careful. We all, young, middle-aged, or elderly, are inadvertent addicts of this malady, whether by choice or compulsion or necessity. Social media has changed the way we think, communicate, and express ourselves. We have practically become slaves of this cyber connectivity. Many amongst us can't even imagine a life without social media. It has invaded our lives physically, mentally, emotionally, and our deepest thoughts are captive of it, as if we live only for social media. Worse still, the free access and sensational results in boosting one's relevance, ego, and projection are propelling each one of us to devote more of our scarce time and energy. Sensational social media can be a real vibe killer. It's like, people get hooked on the drama and negativity, and it starts affecting their mental health, relationships, and even self-esteem. Some major issues are cyberbullying and online harassment, unrealistic comparisons and expectations, sleep deprivation and decreased productivity, spread of misinformation and fake news. Whatever governments or administrations may or may not like to intervene to regulate its effect, last Information Technology Act 21, whole world is crippled by its all-pervasive persistence. Some possible remedies? Limit screen time and take digital detoxes. Follow accounts that promote positivity and inspiration. Verify information before sharing. Focus on real-life connections and activities. Practice self-care and mindfulness. We need to frame our societal rules to protect our children and all rational thinking people from this scourge. Orendia 10 mg tablets, Finerenone, are used to treat chronic kidney disease, CKD, associated with type 2 diabetes, reducing risks of kidney damage and cardiovascular events. As a nonsteroidal mineralocorticoid receptor antagonist, it reduces inflammation and fibrosis. Common side effects include high potassium levels, hyperkalemia, low blood pressure, and fatigue. Mechanism: it works by blocking mineralocorticoid receptors, MR, that, when overactivated, cause inflammation and fibrosis, leading to organ damage. Indications: slows CKD progression, reduces albuminuria, protein in urine, and lowers risks of kidney failure, heart attacks, and heart failure in patients with type 2 diabetes. Dosage and administration: generally taken once daily, with or without food. Tablets can be crushed and mixed with water or soft food if necessary. Dosage initiation and adjustment: the initial daily dose is determined by a healthcare provider based on the patient's kidney function, specifically the estimated glomerular filtration rate, eGFR. Administration: the medication is taken orally, once daily. Monitoring requirements: serum potassium levels and eGFR must be checked 4 weeks after starting treatment and periodically thereafter to determine if adjustments are needed. Safety precautions: avoid consuming grapefruit or grapefruit juice while taking this medication. Treatment may be interrupted if serum potassium levels exceed recommended thresholds. Initial dose selection: the starting daily dose is selected by a healthcare professional based on whether the eGFR is greater than or equal to 60 or between 25 and less than 60 ml/min/1.73 m superscript 2. Dose titration: based on serum potassium levels, healthcare providers may adjust the dosage after 4 weeks of therapy. Precautions and side effects: high potassium levels, hyperkalemia, are a key concern. It may cause dizziness from low blood pressure. Patients should avoid grapefruit/grapefruit juice. Important safety warning: consult a specialist for monitoring, particularly for kidney function and potassium levels. Avoid breastfeeding during treatment and for at least 24 hours after the last dose. Use effective contraception for women of childbearing potential. Call to action: which of these breakthroughs surprised you the most? Let me know in the comments, and don't forget to subscribe for your daily dose of medical futurecasting.
Disclaimer: the information must be verified before use. The creator, publisher, and YouTube will not be liable for any negative consequences.